Take a look at this block showing a cross-section of healthy skin. The top layer is the epidermis. Think of it like the roof of a house. Underneath that is the dermis, which acts as the foundation. Normally, the tiny particles giving our skin its color, called melanin, sit safely up here in the top layer. But watch what happens to the surface. These slate gray, bluish, or dark brown patches appearing on the skin are the hallmark of a condition called Lichen planus pigmentosus, or LPP. Because these dark patches show up right on the surface where we can see them, patients and even some doctors often mistake them for everyday pigmentation issues, like mild sun damage or melasma. Following that logic, people naturally reach for standard bleaching creams, brightening serums, or harsh exfoliants. But instead of clearing the skin, these treatments often fail completely. In many cases, they irritate the area and make the patches even darker. To resolve LPP, we have to stop treating the surface. We need to look past what we see in the mirror and understand the microscopic structural collapse happening deep underground. Zooming in, the basal layer separates the epidermis from the lower dermis. In active LPP, confused immune cells attack and fracture this boundary. Melanin granules slip through the cracks, sinking deep into the dermis. There, cleanup cells swallow the fallen debris, becoming permanently bloated and trapping the color deep inside. Because the color is now locked inside these deep cells, surface treatments are entirely useless. It is physically impossible to scrub, peel, or bleach away the pigment that has fallen this far down. The sensation. In residual LPP, the attack is over. There is no itching, just the trapped, leftover pigment. If the condition is active, certain everyday exposures can act like adding fuel to a fire. Heavy UV sunlight, friction from rough towels, and contact allergies to hair dye or synthetic fragrances can all provoke a flare-up. You might read online that specific diets, fasting, or vitamin deficiencies are the secret culprits. While those discussions are popular, medical studies have not found any evidence that changing what you eat or taking supplements will cause or cure this specific condition. To find exactly what is happening, dermatologists use specific tools. As shown in this schematic, they use a tiny cylindrical punch biopsy tool to remove a small core sample of skin. Looking at this tissue under a microscope reveals if pigment is trapped underneath the boundary wall. Getting this precise biopsy is the only reliable way to confirm the condition. It saves you from years of cosmetic misdiagnosis and prevents experimenting with unverified internet cures. Once you have an accurate diagnosis, treatment follows an absolute non-negotiable order. Goal 1 is stopping the active inflammation. Goal 2 is addressing the residual color. You cannot skip straight to Goal 2. To calm that active immune attack, doctors will prescribe specific topical ointments or oral medications. These are designed purely to soothe the confused immune cells and help stabilize that broken boundary line. During this active phase, it is incredibly tempting to visit a clinic for fast-acting cosmetic procedures like harsh lasers or even microneedling or strong chemical peels. You must avoid these. Look at what happens in this animation when a laser hits actively inflamed skin. The physical trauma sends the immune system into an absolute panic. The cells multiply rapidly, the boundary shatters further, and a massive new wave of pigment drops into the deep tissue. Hitting active LPP with aggressive, fast-acting procedures backfires. Instead of clearing the skin, you end up with patches that are larger, darker, and much more stubborn than when you started. So what can you do daily? First, drop the complex 10-step skincare routines and strong exfoliating acids. Your skin needs a break. Switch to basic, gentle moisturizers that help repair your skin's natural protective barrier. Next, you need the right sun protection. As we see in this diagram, a standard sunscreen only blocks invisible UV rays, letting high-energy visible light pass right through to worsen the deep pigment. To block both UV and visible light, you need a tinted sunscreen that specifically contains iron oxides. Navigating this takes a toll. Waking up to sudden, visible changes on your face, spending money on treatments that do not work, and feeling anxious about stepping out into daylight is exhausting. The emotional distress and treatment fatigue are very real, and it is completely normal to feel overwhelmed by it all. Let's look at this checklist for your next 3 steps. 1. Take monthly photos in consistent lighting so you have a true record of any changes. 2. Strip your skincare routine down to the absolute gentle basics. And 3. Consult a dermatologist to ask specifically for a biopsy. LPP requires immense patience, and there are no overnight fixes. But by understanding the biology beneath the surface, you can stop fighting your skin, step off the roller coaster of harsh treatments, and take your first real step toward long-term stability.